Hey everyone, Cassandra Hein here with my good friend and go-to doctor for Healthcare TV Network, Dr. Raj Dasgupta.
Hello everyone.
I know that a lot of people are staying inside right now, and Raj has recently been on E! News and Forbes and Huffington Post and Reader's Digest, and you're a regular on KTLA, and so you're kind of the go-to person, especially since you're a pulmonologist for the coronavirus right now.
I know, and you know what else, Cassandra? It took me 0 time to get to work today. So usually I gotta factor in the traffic. I didn't even finish sipping my coffee, and here I am. So you always want to look at the positive in everything, and the positive is there is no traffic.
Yeah, especially here in LA, right?
Exactly.
With friends and family and everything that's going on right now, I think that there is a little bit of a scare right now. Is everyone going to die from this coronavirus? And I think that this is a big concern because we're being put in, we're not quarantined officially, but, I feel like that's where it's coming to. And so since you've been on all of these news outlets talking about this and, the questions that you've been getting in, we've consolidated some questions for for you. And so we're going to do 20 questions about the coronavirus in 20 minutes with Dr. Raj.
That is catchy. I'm loving that title already. The 20 for 20. Okay, yes. I like this already. You got my full invested participation now.
Okay, awesome. Okay, so we're going to start with just the simple question. What exactly is this coronavirus?
Well, coronavirus has been around for a while. People don't realize that. People think this is brand spanking new. It's been around since like the 1960s. And when we talk about coronavirus, many people were infected. Millions of people were infected. But coronavirus has actually, lack of a better term, different strains. Some affect humans, and some actually will affect animals. And the ones that affect animals really had no business with us. But when they mutate a little bit, that's when it causes a problem. And for an example of that, there was something called SARS. And when we talk about SARS, that's severe acute respiratory distress syndrome. And this was initially something with animals. Same thing when we talk about this terminology, this disease we call COVID-19. This was something initially that was going to be seen in animals only. And everyone always asks me, what animals are you talking about? Like bats, because when you go back to China, that when they were in the food places, that they were actually dealing with different animals, that could have been a route of transmission. And once they mutate and they affect us from animals to maybe a human type virus now, that's when the problem begins.
So if, there are different types, are there different types of this virus right now? Like, is there a new strand that's happening even after the last couple of weeks? What does that look like?
Yeah, and so, I think I want to take a step back, and people have been asking me, what is the official name of this disease? Because it is kind of confusing, kind of playing off like, what is the strand, So there is names for viruses and there's names for diseases. So when we talk about the disease itself, it's actually called coronavirus disease, COVID-19. And why am I making such a big deal today about name of disease, name of virus? Because of the fact that, let me give you an analogy. When we talk about a virus, HIV is a virus. What disease is it called? Is AIDS. So when we talk about the disease here, it's COVID-19. What's the name of the virus that we're talking about? It actually has a really long name, like myself, So it's severe acute respiratory syndrome coronavirus 2. So it's called the SARS-CoV-2. So that's actually the name of the virus itself. That's like the example of HIV. So when we talk about the name of a virus, that's based on genetic structure itself. Versus the disease, we name the disease so we can help out epidemiologically about how to prevent it, how it's spread, what's its incidence, and all things like that. So to answer your question, this is a new, strain, mutation, lack of a better word, talking about that type of coronavirus that usually should be just in animals, but now obviously it's here in us, humans.
Yeah. So, we've been talking about, how is this transmitted? What comes to mind is, wash your hands. It's that scene in The Aviator where he's like washing his hands all intently. I think that's where I'm at right now.
Right.
You know, but how is this transmitted? How is it?
So let me always just say this. The answer is we don't 100% know. I'm going to tell what most people heard on the news, what most people believe in, and you said it yourself. A lot of it's going to be, just washing your hands, be careful to have that transmission. So anytime, let me just take one step back. People ask me about coronavirus. The hardest thing about it is that you literally do need to have a laptop open right next to you to get information as it's coming in, because it's always changing. And every time you say something, someone will say, that's wrong. I read one study in Antarctica that showed this. You're like, I'm sorry, it just came out. So the answer is we don't 100% know. But what we do know is respiratory droplet, which means that when you cough, what should you do? Cover your mouth, you know what I mean? Just like this. I don't know if you can see me, but I did it, and you always want to keep the 6 feet rule, because most of these respiratory pathogens, viruses, bacteria, you want to keep that 6 feet away, this is a virus. So also when we talk about transmission, that's why we're kind of wiping things down, because we know that the virus can live on certain surfaces, and that's where the question becomes, what surfaces and how long? But we do know that if you disinfect these surfaces, it will kill it pretty quick. And that's why we have a shortage of all these, Clorox wipes and everything like that. So I think this goes back one step, which is always going to be, I am always about being prepared. I'm always about prevention, but don't use the third P, which is panic. We don't want to have any panic.
Good advice right now, especially like I was at the grocery store and all the water is gone.
Yeah.
But I get my water at this local spot where, it's just filtered and alkaline. And so we're like, oh, we're good. It's a mile away, No.
My wife told me to go to the grocery store to pick something up on the way home. It was like zombie land in there. Like everything was gone.
I know.
You know what I mean?
All the toilet paper's gone.
Yeah, don't talk to me. And if you do talk, I don't know if I'm even a human. I don't know what they're saying.
I don't know if it's you, but if I was really in a situation where I didn't have toilet paper, I'd get in the shower.
Okay, this isn't one of the questions, but I heard, there's always some mean jokes out there, you know what I mean? So I heard that, someone made this mean comment that certain races, certain nationalities will not be affected by the toilet paper shortage because they don't use it to begin with. I'm like, that's kind of mean over there,
Well, yeah, I mean, there are some cultures that don't use toilet paper.
That's the word I'm looking for.
Yeah,
exactly.
Yeah, and that's actually true.
It put a smile on my face until I realized maybe they're talking about me. So I think it was funny.
I think we're the ones that are being made fun of.
Totally.
So when it does come to disinfecting your hands, is water enough? Like I know that soap is, it said, that you need soap, but if I don't have soap, can I get it off with just water?
Yeah, so this was a really common question on all my media platforms. So the answer is, it's relative to what? You know what I mean? So if you're not going to use water at all, use water. You know what I mean? I'm going to say you need to get the dirt off your hands. So, you know what I mean? It's going to be not washing at all or using water, use water. You know what I mean? But by far, you need the soap. You need the soap. You know what I mean? Yeah. And of course, there are people that hyper-focus on every word out of anyone's mouth. And yes, there are little differences between soap and detergents, you know what I mean? But soap is good. You need it, And then if you definitely don't have soap and water, then of course you want to use these hand sanitizers, And when people talk about hand sanitizers, they often ask me, well, is that going to kill all the bugs? And the answer is no. And what bugs are they not going to kill? A lot of these GI stands for gastrointestinal, these diarrhea bugs. So in the hospital, for my hospital people watching, hand sanitizer doesn't clean something called C. diff, which is a bad type of diarrhea. For people going to daycare, there's something called norovirus that can cause diarrheas. So there are different diarrhea type bugs, viruses, bacteria that can do it. So you definitely want to do some soap and water in these cases. And if you don't have anything, please at least use some kind of water, but it's not really the trick.
Yeah, and if you don't have it, or you want to make your own, maybe like homeopathic type, I don't know if you have that option, but what would you suggest for making your own?
Cassandra, I'm loving this conversation more and more, you know what I mean? But so this is the hottest topic, you know what I mean? So recently, I was doing an interview and people were asking me about, hey, making my own hand sanitizers. And of course, when you only have a few seconds to answer, you just want to get the main theme out, which is, that's a bad idea. You know what I mean? But of course, now that I have more time, I'm talking to my favorite person, which is you. You know what I mean?
Thanks.
You're welcome. That the answer is, relative to what? You know what I mean?
Yeah.
So of course, you know what I mean? If you can't purchase hand sanitizer, you know what I mean? It's not available. I mean, it's zombie apocalypse. Yes, go ahead and make your hand sanitizer. The reason why I would say that my first instinct is because of the fact that, number one, safety. You know what I mean? I do realize people can make hand sanitizers, and it's kind of funny that all of a sudden there's all these recipes for hand sanitizers that come out. You know what I mean? So like everyone's like, it's like carrot cake. Here's my hand sanitizer. Uncle Bob made this one.
Yeah.
And you do it, it's like, yeah, you take some isopropyl alcohol, you know what I mean? Some rubbing alcohol, and you mix it with some aloe vera. And I'm just saying the broad things. I don't know. You know those people, Cassandra, that you're like, I don't think you should be making your own hand sanitizer.
I would say, tea tree oil is very like antibacterial.
Yeah.
I would go to. Maybe
but there's some people you're like
antibacterial, tea tree oil.
Yeah. And and in the take-home message is that you need to have at least 60%, concentration of the alcohol part of it. I just don't know. And there could be some risk. You're giving it to your kids, you're giving it to some of your grandparents, you're putting on your skin. You want to make sure, you know what I mean? Right. And yes, there are people who probably can make it and it's great, but my whole thing is that it's your life, it's your kids, it's your loved ones. If you can buy it, buy it. Can you make it? Yes. You know what I mean? But that wouldn't be my number one theme.
Right. Yes. Okay, so when it comes to maybe wiping down your surfaces,
yeah,
what should we keep in mind when, how do we really make sure that our countertops are really clean?
Yeah, and I'm all about the basics, you know what I mean? And so I really feel that how I teach my medical students is how I talk to my friends, my parents, and even when I do little webcams. And so I was blown away how many people didn't know how to wipe down a surface, you know what I mean?
Really?
So I'm not going to quiz you because I'm going to put you on the spot, you know what I mean? But when you wipe down a surface, you know what I mean? You're going to take your wipe and do a one wipe across, you know what I mean? But quite often I'll see people wiping their surface like they're like doing the
like around
kid,
like this,
the wax on, wax off.
Well, yeah, I mean? you need to get the grease off,
Oh my God, Cassandra! But once you do more than one wipe, you may lack of a better word, reinfest it, or you just desanitized. You know what I mean? So it's one solid wipe. And then don't take another piece of paper and dry it. You know what I mean? You want it to air dry. Right. So very simple things of how to do things is very important. You know what I mean? And let me carry that over to when we talk about the people who clean my patients' rooms. They gotta get trained in very special ways of what you use, how you use it, protect themselves, protect others. But it is funny that, we're all talking about desanitize and carry this, but you go in an airplane, I'm telling you, I was right next to someone cleaning down their tray and TV, and they're just like,
yeah.
And I'm like, I don't know if that did anything.
You're like, I don't want to be an a-hole, but
yeah, exactly.
You're not doing that, right?
I wanted to take the sanitizer and kind of wipe that person down a little bit.
Yeah, exactly. So so then washing your hands. I hear that, say row your boat gently down the stream twice, doing that whole thing twice, or happy birthday twice,
well, what's yours? What are you? What's your go-to song?
Happy birthday.
Happy birthday. So I think that there are going to be certain numbers that we put in our mind. I think that the hand wash is 20 seconds, and there is some data out there about your drying time, but I really focus more on the hand wash itself. You know what I mean? And I think you're right. I mean, the happy birthday, but I got to tell you, Cassandra, if I hear happy birthday one more time around the sink, you know what I mean? I'm going to freak out a little bit. So
well, you also have 3 small children. So
I do.
They probably sing that song when it's not their birthday.
Totally. And so what's kind of cool, and maybe kind of taking this for a little spot off to the side, was people are doing everything they can to help, be positive. And I remember there's a song, I think it's called I Will Survive. Yeah. You know what I'm talking about?
Of course.
I can't think of the artist, and she's
Aretha Franklin.
You know what? I'm going to put you on the spot. It's not Aretha Franklin.
It's not?
Wow. You know what?
Oh, no. It's,
I'm going to say, more about this stuff than I do.
Oh, no, it's not Aretha Franklin. That was
it's
so
Gloria.
bad.
It's Gloria.
No, it's who?
But I'm going to go with the first name. I think it's Gloria, blah, blah. Gloria. Sorry, Gloria, if you're watching this. I just know that I like your song very much. And what I saw on social media was that instead of doing the happy birthday, that there's this challenge where you could wash your hands singing "I Will Survive." You know what I mean? And I thought that was kind of cool. You know what I mean? Because you got to go through some other songs in there. And, you know, everyone is trying to play their role, whether it's going to be being happy or coming up with a new song, you know, and how does this relate to medicine? So, you know, when one thing we have in the
Gloria Gaynor. I didn't know that.
I told you.
Oh my gosh.
I hope you hear this, Gloria.
That's good. I'm glad I know that now. I'm going to use that.
I'd love to meet you. I'm Dr. Raj.
Yeah, I do think that positive, you know, saying things that are positive, like staying healthy as opposed to, you know, don't get this, or, you know, something that your subconscious would actually see as like, you know, now you're putting that as like the main focal point, you know?
Right.
It's like, there was actually a study that showed like when it said don't drink and drive, there was actually more drunk drivings than it said.
I'm sure.
It said,
exactly.
You know, stay safe on the road, you know? Like
totally 100%.
Yeah.
And you know, as far as songs are concerned, this is a little off topic, but it reminds me, so being positive, right? So we do something called CPR, unfortunately, when people have codes in the hospital. So we do training on simulation. So there's a certain, you know, rate you need to go, not too fast, not too slow. So we sing songs to remind us. So I remember I was doing it with some residents and fellows, and they were doing Another One Bites the Dust by Queen. Another one. I'm like,
Another one bites the dust.
And it was like, I don't know if that's the most positive song.
Yeah, maybe don't do that when somebody's
so someone else jumped in and did it to Staying Alive. And I'm like, oh, that makes more sense. Staying alive. Yeah. And I'm like, okay, being positive, you know?
Yeah, yes, I like that.
Every little thing helps by being positive when it comes to a bad situation. So good job, Gloria, for a good song, you know?
I totally agree. Now, when it comes to maybe testing yourselves, because, you know, we don't want everybody running down to the hospital, right? And this has been on the news and stuff, but should we be going to our primary care doctor? Like, where should we be getting tested for this if we do think that there is a problem?
Yeah, and you know what? And there is a problem, and the answer is that you just can't go to your primary care physician. I wish you could, you know what I mean? Because number one is that it's not just the test itself. I mean, we all know there's a testing shortage. I all know that, you know, we are doing a better job in getting more tests to everyone out there. But if you just go to your primary care physician, is that going to be safe for him or her? And what about the staff? What about people in the office? So you really have to have a nice setup in order to actually perform the test itself, you know? And then I can't say, just run to your ER. That's a bad idea. The last thing you want is an overcrowded ER with patients and people are there not even for anything related to coronavirus to be exposed. So the answer is, you need to have testing facilities. So I don't know if you've seen any yet, Cassandra. There are these tents that are going to be set outside of certain hospitals. You know, unfortunately, we don't have a lot of them set up, but these are places where you can go. People are trained. They have the right equipment to test you. And remember, after they test you, they need to follow you. You know what I mean? It takes, this is the downside, 3 to 5 days to get results. I know, I already watched the news. I know there's some new tests out there that can get it much quicker, you know what I mean? And I want that. But as of right now, it takes around 3 to 5 days. So you're not going to sit in the ER for 3 to 5 days, you know what I mean? So someone needs to get your name, needs to follow up with you when you go back home. And that's something where would be the first step is ask someone, you know, just a little bit higher than you who has a little bit more knowledge about what to do. So for example, if it's my med student, ask my resident. If it's my resident, ask me. If I don't know, I ask infectious disease. But I think for the person in the public, you could never go wrong by asking your public health. You know what I mean? Where should I go? You know what I mean? And from there, or call your doctor's office and say, hey, what should I do next? At least they could lead you in the right direction. The last thing you want to do is just panic, you know?
Yeah, and since we're on this topic, how is this diagnosed? You know, are they pulling blood? How are they doing it?
Great question. So it's diagnosed through a nasal and pharyngeal swab. So they're just going to swab, and what they do is they send the secretions through something called a PCR, looking for the RNA of the virus itself. So we do have the technology out there, and obviously other countries have had this technology and have been using testing massively out there, and now they're having better data about what is the prevalence of disease, what is the incidence of disease. And it's just sad because of the fact that a lot of our numbers in the beginning of this are so off because we just didn't have enough testing kits to give you really how many people are exposed to this, how many people have it. And when you don't know who's exposed, then you can't isolate. and that's how things got, started cascading in the wrong direction initially.
Right. So, the influenza vaccines are a very hot topic, and as it is, and I probably know what your perspective would be on a vaccine, but why don't you tell us what it is? Because I think it's important.
Oh, definitely. Now, do you want me to touch base? Because, I'm already to chatter about coronavirus vaccines, if there is one.
Yeah.
Okay. So I would say twofold. Number one is that when we talk about influenza, and I'm going to start off with this, so just bear with me a little bit, you know what I mean? Is that influenza virus and coronavirus, referring to COVID-19, mean they present almost exact. You know what I mean? If I had COVID-19 and you had influenza, you couldn't tell who had who just based upon the history. Because when you look at the symptoms, when you talk about COVID-19, cough, fatigue, fevers, you know what I mean? It's very non-specific and it looks just like influenza, So when we talk about influenza virus vaccine, I'm sure I said this on national TV that there is actually people who regret not getting that vaccine, because right now, when testing is not as easily and not readily available, if I had me and you came in with same symptoms, if I knew you or I got the influenza vaccine, that puts you at a higher risk for corona, because I know you got the influenza vaccine, so it can help clinicians out. But even with this coronavirus going around, people should get their influenza vaccine. It's so important from now, even going forward, Then on top of that, there's something called the pneumovax, which is going to be the pneumococcal bacterial vaccine that initially people who are 60 years of age should start getting it. But if anyone has any respiratory disease or chronic medical illness, you should strongly consider getting the pneumococcal vaccine. And this pneumococcal vaccine is for strep pneumonia, and there's many of them out there. And now we're going a little medical. There's a 23-valent that people call Pneumovax. There's a 13-valent people call Prevnar. And your doctors or healthcare professionals should know exactly which one to give you. And if you got one but not the other, it's pretty much okay to get both. But these are great questions that you should ask your healthcare provider about pneumococcal vaccine and getting that influenza virus vaccine.
Okay. So switching gears a little bit and, and seeing how this is affecting us socially, what in your opinion is the effects of this social isolation, or what are your thoughts on social isolation?
Oh my God. So that is a great question. And you know what? Give me a cue, because I want to go back about corona. Is there going to be a corona vaccine? I actually forgot to mention that. So let's talk about social isolation too. So I think this is something that we need to do now. I think the key thing is that when would have been the best time to have all these protocols in place to help us out, prevent spread and everything, is when we knew the first case that came to the United States. The first case came, I believe, in Washington, D.C., someone in a nursing home. If we had testing available at that time, it would have been wonderful to test everyone that was in contact, so we know exactly who to isolate, because usually when you have a virus and an outbreak, you're gonna ask questions like, did you travel to so-and-so? Did you have a contact? How did you get it? But now we have community spread. How do I know that? A lot of the cases in California are random cases without known contact or without known travel. So now that it's community spread, it's already out there. So the only thing that we can do to help out with the rate of the spread is going to be to do social isolation, which is easier said than done. You know what I mean? But I think that everyone is trying to play their part as much as they can, and we're socially isolating. So hopefully that the incidence, meaning that how many cases per day, will eventually start going down. And we really, really want that. You know what I mean? And, I've already heard right before I come on air with you that this may start to happen already in China. They had it way before we had it, and their incidence may start going down, which tells me, wow, you make an effort, you stick to it, and there is light at the end of the tunnel. So I think this social isolation is, not going to end community spread. It's going to be there, but the rate at which it travels and protecting the people who are at the highest risk. That's what it really comes down to. Let's protect our parents. Let's protect people who, when they were younger, helped us build this country. So helping the elderly, it's going to be, the big thing why we do this.
Yeah, and I think that's why they've closed schools, and that's why they've closed, bigger institutions, anybody over, I think like 100 people congregating, I think is not, that's like kind of the number, I think.
Yeah.
Right now.
No, and you know, and I think every says a different number. Some people quote 50, some 100, some 200, you know, and it even goes beyond, you know, the bigger pictures. I think movie theaters are blacked out. You know what I mean? The restaurants, you can't go in now. You're going to have to order from your favorite restaurant, which is not a bad idea. You know what I mean? But there's so many ways to social isolate. But once again, it's easier said than done. You know what I mean?
So you wanted to touch upon the coronavirus vaccine.
Yeah. So this kind of leads to a question someone asked me. I thought it was an amazing question, which is, hey, Dr. Raj, I was infected with COVID-19, but now I feel better. I'm better. I recovered, which happens quite a bit. You know what I mean? Most people will have very minimal symptoms, or they'll be asymptomatic. So the question became, are they now immune to it? And I'm like, wow, that's a great question. You know what I mean? And the answer is that these people who actually survived, you know, the coronavirus, their blood, their serum probably contains some antibodies that we need. So one of the hot topics is people are trying to, lack of a better word, harvest that serum to get those antibodies to help make vaccines and cures and so forth. It sounds great when I talk about it, but obviously there's a lot of practicalities in how we do it, you know, the technology behind it. But to answer the question directly, technically speaking, if the exact same virus reinfects someone who had it, the answer is they should be immune. But we know that these viruses mutate. And how do I know that? Let's go back to what we were talking about, influenza. Every year we have a different influenza vaccine because it does mutate, you know? So cross your fingers, we haven't got there yet, you know what I mean? But that's kind of like how we are hoping to get that, you know, get that coronavirus vaccine in the future, near future. Yep.
So when it comes to a mask, it's an N95 mask, right? What is this?
So, you know, when we go to the hospitals or you see different types of masks, there's some masks that people see, they probably buy it from like a Home Depot or something like that. You know, these are just your standard surgical masks and they don't really do too much, you know what I mean? And that's where that whole thing came about, hey, if you're not sick and you're wearing a mask, you probably have a higher chance of getting coronavirus COVID-19 because you're touching your face and all these things. And clearly the only people that should be wearing masks are people who are sick themselves to help prevent that spread. An N95 mask, you know, and I think that N95 stands for, you know, protects you from 95% of these aerosolized pathogens, just keep people wondering, you know. However, the masks that I wear when I'm worried about things like tuberculosis, you know, and they're fitted to my face and my size, they come in different sizes. And, you know, the key thing is that, once again, back to being prepared, prevention, and not panicked, that, you know, I think people hear the wrong information, and there's a mask shortage in many hospitals. I'm not kidding. If I want to go in my hospital and use a mask to go in the room, I need to sign my name because people are just taking masks, you know? And now the people who really need it, which are all the healthcare professionals on the front lines, they're not going to have it, you know what I mean? So once again, it's an N95. These are the masks that we use in the hospital. When I did walk into a couple of rooms, people suspected COVID-19, I have to wear the mask, you know, and that's the mask that we use.
Okay, cool. So, you know, inside it kind of seems like that's where bacteria and viruses might maybe percolate. But what about outside? You know, can we gather outside?
Man, that's another great question. So someone asked me that, you know, they understand about social gatherings, but if it's outside, is it going to be okay? And it's always going to be, you know, relative to what, you know what I mean? So the answer is we don't have a social gathering to begin with because we don't know much about, or as much as we'd like to, about transmission. And of course, someone could sneeze right next to you, whether they're indoor or outdoor, and you can catch something. And it's touching things, touching the picnic basket, touching the basketball you're gonna be, you know, throwing around, you know? So of course you gotta be careful, but yes, if you're asking me, is it better to be outdoor versus indoor in broad strokes where you can catch it the most? Of course, it's safer a little bit outdoor because you're in the open air, you're not in a confined space like a cruise ship or a plane or something like that. So the answer is yes, but you know how people are, you wanna make sure you say the right thing. No social gatherings right now. Don't twist.
Maybe just like go on a hike with a friend.
Yeah, but hey, if you want to take a walk in the park with the 6 feet rule with double Purells in both hands, that's okay.
Okay, so what's your take on the the NBA and all these sports gatherings? I guess they have to play without a crowd.
Yeah. Oh my. Well, my first instinct is that I want to say that I'm very proud of them, and I really do want to say that because I'm a huge NBA fan, and you want to be good role models. Why? Is because we're doing all this, like I said, of course, for ourselves, but for the elderly, people at risk. And I always think of just my mom and dad. You know what I mean? And I feel like the younger generations do look up to many sporting heroes. You know what I mean? And I think that when big name stars, when a LeBron James is not on board with something like this, he has so many fans. And it was just really nice that the NBA, NFL, or NHL, the hockey league, March Madness, you name it, that they really all made sacrifices. And you know what? I know it's for the greater good, but it is sacrifice. And, being a Laker fan, when we were like number one in, in our division right now, I was kind of bummed out that it got, canceled, but I know it's for the greater good, but that's how I feel. Everyone's just doing their part.
Yeah. Okay, so we've heard that Tom Hanks and Rita Wilson have the coronavirus and that they're, in Australia, all quarantined up. Any thoughts on this?
I think that as just a fan, because, Tom Hanks, huge icon, I grew up, my first movie with Tom Hanks was Bachelor Party. And I don't think people remember that. Yeah, Big was awesome. I should have said Bachelor. Maybe my parents heard that. They're like, how did you watch that growing up? But, anyways, he's just amazing. He's an icon, And when you realize that sports heroes can get this, icons like Rita Wilson and Tom Hanks can get this, it shows that, viruses like COVID-19, they don't discriminate. Anyone can get it. And it really just made you aware that, we've got to do our job. You've got to be prepared, not panic, but just do what your role is. But the best part about that is that I heard a tweet, from Tom Hanks, and I love how he was so positive. You know what I mean? Hey, we're doing great, and we're making the most of it. And even I think he had a son named Chet that actually, Instagrammed something out even before, just to say, hey, my parents are doing well, don't worry. And you want that feeling right now in our country to be calm. You know what I mean? Like, hey, that is exactly what most of the data shows, that most of us will be just fine.
Yeah, exactly. Yep. So that's great. We're not all gonna die.
No, exactly.
What's ARDS?
Oh my God. So this must be one of my med student questions. You know what I mean? So that's gonna be adult respiratory distress syndrome. So many people ask me like, hey, how do you die from coronavirus? COVID-19. And it's going to be from the respiratory, the lungs. And that's why people like me, pulmonologists and critical care doctors, are really involved with these patients. So if you're going to die, which I hope no one does, and that's not very common, there's two ways to do it. Number one is that you can get superimposed bacterial infections. And what bacteria you're predisposed to, I'm going to be kind of a med student, doctor-like right now, you can get community-acquired pneumonia. So, the number one bug we worry about is strep pneumoniae, which is, I just mentioned, that make sure you got your pneumococcal vaccine, So we worry about community-acquired bacteria. Mm-hmm. When we talk about another way that you could have respiratory complications, it's called ARDS, which you asked me, Cassandra, which is actually a cascading, inflammatory response in the lung, lack of a better term, which really, if you have ARDS, you're going to be managed on a ventilator. And your lungs are swollen up. It's hard to get oxygen in. It's hard to blow carbon dioxide off. It's a horrible thing. You need supportive care for a while. And that's what we don't want, is patients going on to ARDS. And you never know when it's going to happen. There's no prophylaxis against developing ARDS, and there's very little treatments for it, And I wanted to say this on the medical note, is that you got to be careful that there, about steroids. And I say this because of the fact that when you come to my ICU, I always make a joke that there's no way you're going to leave without me giving you some steroids. It's almost mandatory. But when it comes to,
pneumonia.
Yeah. When it comes to COVID-19, clearly the WHO, CDC says no steroids for those people. You can give steroids if there's something else going on, like ARDS maybe, but for COVID-19, no steroids.
Yeah, actually, you had a client, a celebrity client. Who was it? The blonde lady who she was taking steroids and
had
pneumonia. Who was this?
Yeah.
Do you remember her name?
No, but I know what you're saying is
Yeah.
that, I mean, if you're not the right person to get steroids and you're taking those steroids, it just kind of weakens your immune system. So steroids are, there's a lot of benefit, but there are also a lot of side effect here. You know what I mean? And speaking of that, you know, people were asking me about, you know, over-the-counter medications to take, you know, and once again, you know, it's so hard to answer these because there's so many things coming up at all times. Number one, there was one study in France, and I'm going off the top of my head, that showed that if you take these non-steroidal medications like ibuprofen, you know what I mean, that could it do something? And I looked at the study, it's really small. The CDC, the WHO said, we're not even gonna entertain this because it's gonna cause mass hysteria. And it does, you know what I mean? And that's why I think in this day and age, it's kind of like every time this little thing comes about and the media just blows it up, you know what I mean? It causes more panic than benefit, you know what I mean? But I guess, you know, once again, if you put me in a corner to answer one thing, the only thing right now that seems to be A-okay is Tylenol, acetaminophen, you know what I mean? So, but if you took something else over the counter, you're going to be just fine. I'm giving you my word for that. But then every time you say something, someone's already looking it up on the internet. So it's always hard.
So, you know, what is BiPAP? And
oh my God.
Can it be used for the coronavirus?
Yeah, so BiPAP, Cassandra, you know sleep apnea, right? And when you have sleep apnea, you're wearing these masks like this that look like
little dark picture action.
BiPAP is called bi-level positive airway pressure. So when people come in with respiratory distress, I don't want to intubate them and put them on the ventilator unless they really need it. So many times, just as being a pulmonologist, we give the BiPAP, which helps blow air in and out. So whoever asked that question, you're pretty awesome because yes, there is some data, once again, that show that if you're using BiPAP, that it may actually spread the virus a little bit in the room and cause it to kind of move. Yeah. So there were some statements that say that it's such a spicy thing to say, which is they're not encouraging you to intubate everyone right away, but they want you to be aware that BiPAP may spread the virus a little bit. I mean, how is this going to play out clinically? What remains to be seen. So that's a really, really good question, really focused on people in an ICU setting where they're struggling to breathe. What is the safest thing to do for the patient and for others? Is it just put them on the ventilator or use the BiPAP? Great question.
Okay, good. And then if you do get the coronavirus and you survive it, can you get it again?
Yeah, and you know, like we're saying is that, you know, as long as it's the exact same strain, then the answer is no. But things mutate just like influenza, so just be careful about that one.
Right. Okay. So the last one is, you know, is it a good idea to do your doctor's office visits or even just be working, you know, teleconference wise on Zoom calls? Are we better off working from home and seeing people like this, you know, the way that we're talking right now?
I know. I mean, how much am I going to charge you for this face-to-face there, Cassandra? So, anyways, you know, that's a great question, and that's what I'm doing right now as we speak. So it's all about doing my part. We're talking about NBA players and NHL players. My part is to keep my patients safe, and to do that, you know, my dad has leukemia. I don't want him to go to the hospital. You know what I mean? If he doesn't need to. You know, one of my best friend's mom is a breast cancer survivor. I don't want her going to the hospital if she doesn't need to. If it's going to be a simple conversation, what we're doing now here at USC in my pulmonary department is we're doing teleconferencing. You know, sometimes you just need to come in, but I want you to come in because it's necessary, not for me just to kind of like give you some air knuckles, like great job, keep up the good work.
Right.
So I think that this is the wave of the future. I think that we're doing our parts as doctors to do this, you know. So what I would say to the people who ask the question, call your healthcare provider, ask if they're providing phone conferencing or teleconferencing and see where that goes.
Great. Well, with that being said, I think it's been over 20 minutes, so we're gonna wrap it up.
Let me give one more. One person asked me a question on the way in the car. You know what I mean?
Nice.
So the question is, can I go to the gym and jump in a swimming pool? What do you think about that?
Really?
See, I mean, I'm telling you, it's nonstop questions. And so I want to answer that for a couple things. Number one is that we don't know a lot about this virus. You know, I mean, that's always my first opening statement. We don't know a lot about transmission. Someone already asked that question. So the thought process is when you go to a swimming pool, the chlorine in the swimming pool should do the job. You know what I mean?
Mm-hmm.
But did they study that in a study? No. But the big thing is when you go to a swimming pool, like in a gym, like a YMCA, it's everyone else. It's everyone else touching everything. So I think my answer is going to be, there's no data to show that the swimming pool itself, if you're by yourself, is going to cause anything, but it's everyone else that's going to be there. So just be careful. You know, the social isolation that we're talking about, just be considerate when we talk about that. And I'm going to do bonus time because someone asked me, can my dog get coronavirus? And
that's a big question. You want to know that.
And, and the reason why I said that is because, when we're talking about the animal transmission earlier today, that, I just said the word animals when I was on the air talking about it on TV, and people were just wondering, is it my cute little dogs and my cockapoos and my, all these different things? And the answer is there's no data right now to state that dogs are transmitting viruses. So the reason why I wanted to mention that is please don't quarantine your dog. Don't isolate your dog.
Let them get outside and run around.
Yeah, so just in case somebody wants to ask that. But, I really enjoyed this. This is great.
Yeah, thank you so much. As always, Dr. Raj, it's our pleasure. And if you guys have more, if you have questions, if you're interested in staying up to date with what Dr. Raj has to say, we're going to have a lot of really great information. So just make sure that you go to the link below, and we will make sure that we stay in touch. All right.
Yes, definitely.
And, click subscribe and all that good stuff. And we'll get you guys some more great content. And thanks again, Dr. Raj. That was great.
You are super duper welcome. Stay safe, everyone out there.
All right. Thank you.